I want to check every single disease. I get that question or that request from so many patients in my clinic. So how to fulfill their request with no confusion to the patient and to the healthcare provider. In this video today, I'm gonna present the most common screening test that it's recommended to do. Before moving forward in this video, let me introduce myself. I am Dr. Mara Sukkar, an internal medicine board certified, obesity medicine as well board certified. And I work as a primary care physician and a hospitalist. And in this video, I'm gonna let you know about most important screening tests that every adult has to do with the help with his primary healthcare provider. I'm gonna start with high blood pressure. It's silent, but it's a big killer because no symptoms. And it's recommended to start checking on the blood pressure at the very first visit whenever it happens. The abnormality has to be referred to a program to treat, regardless using medication or diet or exercise. If the readings are normal, we can do that every 2 to 3 years. It depends. Obesity, family history, some ethnicities, if I have any of these risk factors related to cardiovascular disease or the high blood pressure, we do it more frequent, at least once yearly. Hypertension's best friend. What I am talking about, it's the diabetes. So it's recommended to start checking for diabetes at the age of 35. And we repeat that every 3 to 5 years, depends on the numbers I get and if there is any family history or overweight. If the screening methods for early diagnosis of diabetes mellitus are multiple, all of them are accepted. For example, we can use the hemoglobin A1C. If it's more than 5.7 to 6.4, it's pre-diabetes, and then we refer the patient to a pre-diabetic program. If it's more than that, it's over diabetes. If less, we can repeat that test in 3 to 5 years. The other screening test is going to be related to cancers. And when I talk about cancer, there are few cancers, they are recommended to be tested early on and screened. The reason behind picking some type of cancers more than others are incidence. They have very high incidence, and also mortality affecting and avoidable or treatable if we detect them early on, such as colon cancer. The incidence of colon cancer was 1.9 million in 2020, and that number is expected to be 3.5 million in 2040. It's the third most common cancer all over the world, and the second leading cause to death between cancer-related causes globally. So there are so many modalities for colon cancer screening. And I'm going to talk first about the colonoscopy. The colonoscopy should happen once every 10 years. And the benefit or the advantage of the colonoscopy, it visualizes the whole of the colon. And also it will help with removing any polyp can be found. And usually these polyps are the pre-cancer lesions. The alternative for colonoscopy for the people who refuse doing colonoscopy, either for the 2 days of a preparation, the annoying diarrhea, or whatever, is what we call a virtual colonoscopy. It's going to be a CT scan of the abdomen associated with some contrast. So it may visualize full of the colon, and that usually happens every 3 years, whereas the actual colonoscopy has to happen every 10 years, unless otherwise is recommended by the gastroenterologist. And that depends on the finding, whatever, if we find a polyps, if we find any precarcinogenic lesion, has to be more often. The other alternative is a FIT test. What is FIT test? FIT test is a stool test. It can show the hidden blood in the stool, and that is recommended on yearly basis. And there are also other options, such as a stool test that find out about abnormal DNA that's made by cancer, and that's recommended every 2 to 3 years. So many modalities for colon cancer screening, please pick one. Do it after age of 44. The age recommended to start screening for colon cancer is 45 or earlier if I have a first-degree relative with history of overt colon cancer. For other type of cancer, it's recommended depending on the clinical situation. For example, the esophagus cancer and the stomach cancer screening by upper endoscopy, it is recommended when the patient has a Purée esophagus, for example. So it's going to be very clinically guided. My favorite screening test is body mass index that should be done at the very beginning, maybe at the first visit to the primary care. It can be calculated by dividing the weight in kilogram divided by the height in meter. And then we can categorize the person or the patient, normal, overweight, obesity class 1 or obesity class 2. If you believe there's supposed to be more screening tests, or if you have any question regarding specific disease about screening tests, please write in the comment, and I will use all resources of evidence-based medicine to answer your question. Thank you for watching me.